patients are seeing their pediatrician today and are due for immunizations on the basis of routine setting. First thing, we need to understand the word called as pediatrician. Many times we'll get confused. If you're taking a pediatric population, we have to go according to the guidelines. This guidelines are being given by the GC clinical practice, ICS International Conference of Harmonizations, and these guidelines are accepted all over the world. So, pediatrician population starts within units, which is from birth to 30 days, 0 to 30 days we consider it as. Then we do have the infants, which would start from 1 month to 2 years. Then we do have the young child, which would be from 2 years to 4 years. Then we do have the middle child, which would be from 4 years to 10 years. Okay. Then we do have the older child, which would be from 10 years to 12 years. 10 years to 12 years. Then we do have the adolescents, which is from 12 years to 18. Remember, this is very much important. The age group is very much important. And when we are speaking about the adolescent, so when we are speaking about the adolescents, in some cases we consider the medications that can be given for the adolescent as the adult population. Remember, adult population medications can be given, but in some particular cases we still consider them as children. Pediatric population, and we go for the pediatric medication, pediatric particular calculations we are going to give. So here, this is related to the pediatric, right? Where we are going to have the geriatric populations. We do have the young old, middle old, and older population that we are going to discuss in the coming. Now, he has been saying you, all the following patients are seeing a pediatrician today and are due for immunizations on the basis of routine, the routine schedule. First, we need to understand what is meant by this immunization, or we also call it as the vaccination. What happens is, we need to understand about the immune system first. If you are taking the immune system, we do have the complex structure which contains B cells, macrophages, neutrophils, basophils, monocyte, inflammatory mediators such as the interleukins, TNF alpha. And what does this immune system, mainly this immune system, what they do is, they help the body to protect from any kind of foreign substance which have the capacity to cause the damage. Suppose a foreign body comes in contact with a body, foreign component of foreign body. It can be the bacteria, the virus, or fungi. Remember, we call the foreign body as antigens, AG. Okay. So, first, these antigens should come in contact with a human body. We, as a human body, contains many protective layers. Suppose you take the skin is a protective layer. Nasal hairs, they are the protective layer. The secretions in the eye, they are going to be considered as the protective layers. So these components won't allow any kind of foreign body to enter into it. Anyhow, if at all they are bypassing this protective things and coming in contact with the body, immediately the immune system would get active. And when the immune system is getting activated, they'll produce two types of these cells. Okay, one is called as the B cell, which is called as the memory cell. Okay, and one is called as the T cells, which is called as the killer cells. So what you need to understand is this B cell will memorize the antigen and they produce the immunoglobulins. In future, if at all these compounds or the particles comes in contact with the body, they are immediately go for activation. So we call it as the first immunoglobulin that would be produced in presence of any antigen is immunoglobulin G. Remember, at first time exposure, we'll be able to see the immunoglobulin G. When a person has been exposed to this compound with, in second time, you would be able to see the presence of IgM. Remember, first exposure IgG, second exposure IgM will be able to see. T cells are nothing but the killer cells. What they do is they'll kill the things, they'll kill the compound, they'll kill the antigens, and after the activity, these T cells will go into the thymus region where they would be destructed after the activity. Remember, only the T cells will go. If the T cells are not getting destructed in the thymus region, they'll present themselves as APC, antigen presenting cells. Our own cells, which have to protect, would act as an antigen, which lead to the problems such as autoimmune disorders. Because we don't require any foreign particle, our own immune system would be causing that. Rheumatoid arthritis is there, SLE, systemic lupus erythematosus, multiple sclerosis. These are some of the examples related to the autoimmune disorders. Anyhow, the ability of the immune system to protect the body from the foreign body or foreign particles. So, how many types of immunity are there? You have four types of immunity. The first one is natural immunity, which we get from the mother. During the pregnancy, the mother will secrete some antibodies that would be helpful in the neonate to avoid any kind of the issues during the growth. But that is considered as weak over a period of time we have for the vaccines. Natural immunity is nothing but it should be transferred from mother to kids. The only way by which the immune systems are being getting like activated is by the vaccination base, which we call it as the active immunity. Deliberately, we are going to give the virus or the bacteria either in the kill form or either in the live condition or in the inattenuated conditions to activate the immune system so that they produce the T cells. So this process is called as vaccination and immunization or immunization, and this is an effective process in making the child or the individual stronger to any kind of foreign antigen that have the capacity for the damage. Okay. The third one is we go for passive immunity. What does in passive immunity we do is we directly go for giving the immunoglobulins IgG. In the case of the accidents, deep cuts, tetanus injection, we go for taking IgG that is. And the last one is the herd immunity. Herd immunity is nothing but continuous exposure would lead to the formation of immunoglobulins, and that would be much more effective in controlling the conditions. During the COVID-19, we might have come across. I mean, all these things, if at all we are taking the active immunity, has been considered to play a bigger role in controlling the disease condition, because we are going to give the bacterial virus deliberately to activate the immune system. So whenever we are going for vaccination, the immune system should be in a very good condition to accept those the challenge and produce the immune. The question number two is saying the same thing. All the following patients are seeing a pediatrician today and are due for immunization of the basis of protein schedule. For which one of the following patient would you differ, or would you recommend differing immunization until later? That is, in this patient, you won't allow the person to go for vaccination. As a total, someone has been asking you, like, would you recommend for differing? You will say that no. But there are two such conditions wherein you have to refer differing the immunizations. So we'll understand what is meant by differing. Differing is a word to represent stop or change the timing of vaccines. Okay. So in which condition we have to change and what we need to do is we'll understand the concept over here itself. The first condition is human immunodeficiency virus. The name itself is saying that this virus is going to cause the deficiency of immune system, HIV we consider it. Now, what are the factors that is been related to the HIV drug? Who would be infected with HIV? Remember, 99% of the cases of HIV are related to homosexuality. The remaining 1% are related to the blood transmission, tainted blood transmissions, and the unprotected sexual intercourse or sexual contact with any person who is already been infected with the HIV, and the drug abuse patients or drug abuse people who would share the syringe with them. These are the four factors, but 99% of the factors are related to the homosexuality in causing the transmission of HIV to an individual. Anyhow, suppose a person has been infected with HIV, a person is came in contact with the HIV, what happened we'll understand. For that, we'll understand the structure first. And the structure of the virus, any virus if you're taking would be the same. That you'll be able to see the single stranded RNA. Okay, and I'll just go for drawing the viral envelope. Right, yes. And you would be able to see some spike because you have seen the COVID-19 also. Same spikes would be given. The spikes are nothing but the proteins which play a major role in attaching to the host, guys. Remember this. These are glycoproteins, GP 120 and 40. This is a viral envelope. Okay, this is an RNA, ribonucleic acid, and this is the reverse transcriptase, which is also seen in the DNA, guys. So what happens is, as soon as a person gets contracted with the HIV, the first thing that you'll be able to see is this HIV virus will go for fusion, like they'll go for attachment. Right? So suppose this is the host body. Okay, this is the host cell. There are two receptors present on the host. One is called the CD4 and one is called the co-receptor called as CXCR4, CXCR5. These are the two receptors. One is the direct receptor and one is the co-receptor. Both of them are being associated with the T receptor itself. Now, suppose a person has been infected with the newly infected patient is, suppose newly infected is the HIV would bind to this one. Suppose the person has been lately affected with the HIV, they'll bind. Whatever it might be, remember this CD4 is being considered as the backbone of immune system. It is very much important to understand. This is the called as the important pillar of our immune system. Normally, what you need to understand is the values. The values is between 600 to 1500 cells per millimeter. These are the normal values of the CD4 count. It can differ. Suppose we do have around 7 students over here. I can have around 600, 700. You might have around 900 or thousands or 1100, whatever it might be. Suppose an individual have around 800 cells per millimeter. Suppose. Okay. So it has been assumed that, or it has been clearly stated that any person who has been suffering from HIV, at least 40 cells per year would decrease. Suppose 800 is the value. The next year, the person value would be around 760. The very next year, 720, 680, 640, 600, uh, 560, 520, 480, 440, 400. You can see how the values have been getting decreased. So every year the values would be decreasing less, and there would be some point where the value would be reaching to 200 as well. Remember, till 200 also, the immune system is somewhat strong. I cannot say strong, somewhat strong. They do have the capability to avoid any kind of infection. But there would be some point in the HIV guys where the value would be reaching to less than 200 also. Once the value is reaching less than 200, remember the immune system has collapsed totally. And here the person is not called as suffering from HIV, the person is being called as suffering from AIDS. Acquired, because it has been acquired, it is not natural. Immunodeficiency syndrome. Why we call it a syndrome? Because all the problem related to the immune system would be arising, such as asthma, COPD, meningitis, leprosy, TB, gonorrhea, pelvic inflammatory disorders, syphilis, all the problem related to the immune system would be getting exaggerated over. There's a reason we call it as AIDS. When the value is reaching less than 200, above 200, we call the person as suffering from HIV itself. Is it clear, guys? Am I clear? Yes, sir. Right. Now, remember when the value is getting decreased less than 200, we cannot increase the value of CD4 count by any means. We cannot increase. If we cannot increase, can we go for vaccination? No. So, deferring, that is, stop the vaccination indefinitely in the case of HIV when CD4 count is less than 200. We cannot go for the vaccine in the life of an individual. Now, come back to this picture, guys. As soon as they have been attached, the viral envelope is dissolved, and what they do is they causes the release of the content into the plasma of the body. Okay. So what happens is with the help of the reverse transcriptase, this would go for production of a false strand, guys. Remember this. This is called as false viral DNA. This is only one virus which has the capacity to change themselves into the DNA, guys. No other virus has the capacity to change to DNA. That's the reason it is much more problematic in an individual. Why they are changing themselves into DNA? Because the human DNA is made up of the human body is made up of the DNA, double standard DNA. So suppose this is the human DNA, healthy DNA of the human body. What happens now over here is this virus would get integrated into human DNA. This process is called the integration. Now it doesn't have to work at all this because the human DNA would go for the cell division. Yesterday also we have studied about this one in this process, guys, right? The mitosis G1 phase, S phase, G2 phase, we have studied in the S phase, there would be uncoiling the formation of the daughter DNA, then the coiling will be happening. The same thing happens over there. Integration would be happening. And because of this integration, we would be able to see the damage to the host cell DNA. And then with the help, like you'll be able to see, they'll be going for the formations of the new strands, infected strands, and with the help of the enzyme called as protease, we'll be able to see the viral envelope getting developed over there, which we call it as the body. That means they are being going to affect the new host DNA. So what do we do is to avoid all this process in an individual, we cannot we cannot completely avoid the infection, but we can slow down the process of infection. Yes. But to avoid the infection, the first medication that we do is we go for fusion inhibitors. The medication example is Naravirus. Then, to avoid the change of RNA into DNA, what we do is we go for a medication called as NRTI, that is nucleoside reverse transcriptase inhibitors. We call this medication as antiviral DNA drugs, which are the direct acting medication drugs. So they won't allow the RNA to change into DNA. The medication example is Zidovudin, Stavudin, Lamivudin. Then we do have the medication non-nucleoside reverse transcriptase inhibitors, which is being considered as indirect, which only act they will be considered as the antiviral drugs. Why we are given this medication? Because whenever we want to stop the DNA, it will change into RNA, and whenever we want to go for the RNA drug, they will change into DNA. They are very smart. That's the reason these medications are being used in combinations. The medication example is nevirapines and diadonocytes. Remember this one. Next, to avoid the integrations, we go for integrase inhibitors. Integrase inhibitors. The examples of this medication is raltegravir. Next, to avoid the protease budding, we go for protease inhibitors, PIs. The examples of this medication is indinavir. Remember, all these medications are being most more commonly used. And this, remember, zidovudin is considered as the best medication. They are also used during the labor pain to avoid the transfer of HIV from mother to the fetus. So, I'll write some of the question, guys. I don't know whether you have taken all the files or not. We do have a new file, that is file number 2. Last file you'll be able to see in the file number 2. If at all you have not taken those files, take the whole files immediately, guys, because we are going to study on and off questions related to all these things. So in the file number 2, if you have not taken, don't worry, I'll just write the question so that you can take the file and you can take the questions. Question number 118 would be related to this. Then also you can go for the question number 262. The same would be given. If you do have, check it. If you don't have, you can refer out of this. Now, the other thing where you have to go for checking the vaccination status is the cancer base. Because in cancer also the immune system would become weak because the immune system has to fight with the abnormal cells. Then I'll just take a picture to demonstrate you how the immune system would get weak. So you can see the tumor antigens would be there. They are really tumor antigens. The antigen present in cells would gather around the tumor antigens and activate the T cells. But the T cells have to go for the activity. Now, this activated T cells will bind the tumor cells and destroy the tumor cells. And during this process, you know that the T cells will go into the thymus region and go for the destructions. So what happens is because the cancer is not going to be localized and not going for a short duration of time, it would be the therapy itself would be for a longer duration of time. During the therapies, what happens is the T cells would also get distracted, but they have to go for the thymus region. So the immune system would become automatically weak over there. So any person who has been treated with the cancer, we have to at least wait for 6 months. Okay, recently, if at all a question has been given, it can be 1 day, 2 days, 3 days, 10 days, 15 days, 20 days, whatever it might be. We have to wait for 6 months to keep the vaccination again. So change the timing of vaccination in the case of cancer. Remember, only in these two cases we have to change or either stop the vaccination. Apart from that, we are not allowed to change or stop the vaccination to any individuals. You can see the question number 2. In a question number 2, all the following patients are seeing a pediatrician today and are due for ignition on the basis of putting settle. For which one of the following patients would it best to recommend the ignition until dates? And see a 12-month-old boy who recently completed cycle of therapy for acute lymphocytic leukemia. The option number C, they'll be saying you a 12-month old HIV positive boy whose most recent CD4 count was greater than half. Okay. So if less than 200, we have to stop the vaccination. I have forwarded the guide like like at what age we have to go for the vaccination. Guys, you guys have to read those schedules, uh, like first dose, second dose, and third dose when we are giving birth to 6 years, 7 to 18 years. So and adults also have need to check those things. Okay. Next, you can check the question number in the same file. You can check the question number 12 and the question number 18. A 2-year-old old child came to the clinic for taking hepatitis A vaccine. We know that he took pneumonia vaccine from Monday. What should be done? Give the vaccination immediately. What have to stop the vaccination? Then a 2-year-old child has taken hepatitis A vaccine and came to take MMR vaccine. What should be done? Should give the vaccination immediately. You don't have to go for changing the status of the vaccination associate. After the class, you can check uh, the things. I will go for the question number 14 because it is related to vaccination status. So you'll understand. Question number 14 will be saying you, a nurse, healthcare professional was giving the medication to a hepatitis B patient. Understand the concept over. Okay. And she came accidentally in contact with the blood vessels. It can be like the nurse was having a deep cut or the syringe has been pricked into the nurse. It can happen. And immediately she has gone for a test. The test shows that HBsAg negative, that is hepatitis B surface antigen is negative, that is the nurse has not been infected. As well as the hepatitis B surface antibody is also negative. That means the vaccination of hepatitis B has not been happened to the nurse. You can ask me, sir, when antibodies are negative, the infection chances will be positive. But why the nurse has not been infected with the hepatitis B? You need to understand that at the time of contact with the blood of the infected patient, the nurse immune system was strong. But during the course of time, the infection can happen because the immune system can become weak at any given period of time. So here, what do we need to do is we have to go for prophylaxis. What prophylaxis we need to do is we have to go for immunoglobulins G, okay, because the antibodies are not been there. And then we have to anti-vaccination because vaccination takes time to produce the immune cells, antibodies. That's the reason. What do we do is we go for immunoglobulins plus vaccination in this case. Suppose the same question is being given, okay, and instead of negative, they have given you positive. HBsAg is positive and HBsAb is also positive. That means after having the antibodies, the woman got infected with the antigen. This means you need to understand that the woman was vaccinated, but a new virus strain has been infected. Because during COVID-19 also, after taking the vaccination also, most of the person was suffering from COVID-19. Why? A new strain, a new RNA, a new the capacity to cause the infection was seen. So here we have to go for the treatment. In our books, TDT is nothing but the treatment. In the treatment, we have to go for the antiviral medication, that is ribavirin. Plus, we have to go for a protein called as interferons. Interferons are the G receptor proteins, and ribavirin is the antiviral medication which is being given for hepatitis A, B, C, D, and E. Remember this. So you can see the question number 14. It is related to prophylaxis. A nurse was giving the medication to a hepatitis B patient when she got infected with his blood. When she made analysis, the result was HBsAg negative and HBsAg negative. So what should be done? Give her immunoglobulin plus vaccination. In the coming the file will be able to see about the treatment also. Then we do have the question number 15. Suppose a mother is been suffering from hepatitis B and is due for the labor pain, okay, and is due for the delivery, suppose. There is 99.9% of chances that the child will also suffer from hepatitis B. Remember, at the time of birth or after the birth, within the 12 to 24 hours, the child would be given with two types of vaccinations. One is hepatitis B and the other one is the BCG, Bacillus calmette-guerin, to avoid the TB and leprosy, and also the hepatitis B to avoid the liver failure. So, if a mother has been suffering from hepatitis B, then we have to go for vaccination. Apart from that, we have to go for the immunoglobulin G for the baby who is born. Why? Because there is a chance of the infection. You can check the question number 15, and also you can check the question number 87. Check it out, guys. I hope the questions are very much clear. Now we go for the question number 3, guys. Before we go for the question number 3, we have to understand about the human respiratory system, which is very much important. Okay, so we'll just go for the diagram, then we'll understand the concept of it. Uh, we'll take this as the trachea, then we'll go for the, they would be divided into the primary one, and this primary one, primary bronchioles will be divided into the secondary bronchioles, and this secondary bronchioles will be divided into tertiary. Okay, and this tertiary bronchioles would be open into the cell, which we call it as the alveoli, or we call it as the alveolar sac, and they contain the alveoli. Right. So this is called as the alveolar sac. This is the alveoli, and this is considered as the tertiary bronchioles, and all this area you can consider as the respiratory area of lungs. Why? Because this area will be able to see the exchange of oxygen and carbon dioxide. Okay, and because we are taking this, we do have the trachea, or we also call it as the windpipes. And what is the function of them? Is to only go for inspiration, that is inhale of air, and expiration, exhaling of air. Okay. Now, come back to the next. There are two problems that we need to understand related to the trachea and the alveolus. One problem is being called as the asthma, and the second problem is being called as the COPD condition. So we'll understand one by one what it is related to, how you see the. So we'll understand the asthma first. Asthma is being considered as the inflammation of the airways. That's it. Inflammation of the airways or the windpipes, or we also call it as the trachea. This area is this, and this. Okay. So what happens because of this? Because of the inflammation is the airways will become constricted. Bronchoconstriction we call it as. Because of the bronchoconstriction, a person would suffer from the shortness of breath, and a person would suffer from the cough, and this cough would be having a pattern. It will start at very late night and goes up to early morning. There would be a pattern related to this one. Okay. Now we'll go for understanding the how the inflammation will be taking place. What will be able to see. To understand that, we'll draw the airways. This is the airways. We'll be able to see an epithelial wall that will be covering simple squamous epithelial wall, we call it as. And surrounding this one, we'll be able to have a thick layer of mucosal wall that would be protecting the airways from any kind of infection. Okay. Damage to this mucosal wall, we'll be able to see that the person will be suffering from the protective cough. So, airways, epithelial wall, and then we do have the mucosal wall. Now, we need to understand the factors that would be causing this problem. Factors can take pollen grains, dust, mites, animal furs, animal hairs, and wooden industries. Like the person working in the wooden industries, there would be a lot of dust. All these are being considered as allergic. That is, it is not from the body; it is from the outside. Antigens we can consider. Suppose they are bypassing all the primary protective layer which we have discussed and coming in contact with the airways. Suppose they have entered into the airways. Likewise. Okay. We call them as the allergens. They have entered. As soon as they have been entered into the airways, they'll activate two different types of immune cells. One is they'll activate the mast cell, and one is they'll activate the Th2 cells. Now, this This activation would in turn lead to the activations of histamines, leukotrienes, and the T2 cells with the help of the TS2 cell. They will go for interleukin 4 and 5 and GMCSF, that is granulocyte macrophages colony stimulating factors. Remember. Now this GMCSF macrophages, what they do is they'll activate the bone marrow. So this is the bone marrow. We know that the bone marrow is the area where RBC and WBC production will be taking place. So with the help of the bone marrow activations, what they do is they causes the release of the eosinophils. Now, eosinophils are present in the are produced in the blood vessels. They have not produced. I'll just go for point the blood vessels with the red on this. Right. So the eosinophils are produced in the blood, right in the bone marrow, and they will be present in the blood vessels. Suppose the blood vessels they came in the contact with the blood vessels. So what we need to understand is, as soon as they have been coming, they will be attaching to this layer which is called as the endothelium. So here you will be able to see a protein, attachment adhesion protein called as endothelium. And this would still encourage the binding to the two more DNA adhesion proteins called as ICAM and VCA. Intracellular adhesion molecules. VCM is nothing but the vascular adhesion molecules. Remember this. So, with this attachment, what happens is you will be able to see this mechanism would goes on and will go for activation of RANTES, that is regulations and activations of neutrophils, transmissions, you will be able to see. Matrix inflammatory proteins and macrophages colonization proteins. All of them, what they do is they help in the transmigration of eosinophils from the blood vessels. They will be moving inside the area where the inflammation will be taking place. So they entered into the airways. This is the airways, suppose. Normally, their survival is only for 1 to 2 days. They won't stay more than this one. But because of the continuous process going on of the exposures, what happens is you'll be able to see they'll stay for a longer period of prolonged survival would be happening. Most commonly, they would be staying for 7 to 8 days. And this 7 to 8 days, what they will cause more and more release of cytokines. These cytokines will again release the histamines and leukotrienes. And these histamines and leukotrienes again they lead to the airway injury. So I'll show you what would happen. Okay. Suppose this is the airway which does not have any kind of obstruction. Okay, this is the normal airways. Now, during the asthma, okay, the airway, suppose this is the airway, they'll go for constrictions. You'll be able to see the airways would become constricted. So, asthma patient airways will be seen. Now, during the attack, what happens is the complete block of the airways will be happening. can see that there is no uh, urine attack. So because of this is being caused because of the muscles. Remember, the muscles which are called as the trachea muscles or the windpipe muscles would be there. They are being connected to the beta 2 receptors. So during the asthma attack, this beta 2 receptors, remember, they help in the bronchoconstriction and bronchodilation. But because of the continuous inflammations, this beta 2 receptor present in the airways would decrease. When the airways are being these beta 2 receptors are being decreased, the bronchodilation decreases and the bronchoconstriction would increase. That's the reason if the B2 receptors is being decreased, bronchoconstriction increases, which may lead to the condition called as asthma. That's the reason what we do is we go for the medications called as SABA and LABA, short-acting beta-2 agonist, long-acting beta-2 agonist. In short-acting beta-2 agonist, we get these medications called as salbutamol, albuterols, and in long-acting medications, we go for the salmeterols or formoterols. We go for it. Anyhow, this is the medication which are only being given for controlling the condition, like for the to avoid the SOBs and the cough. But if at all we want to avoid the problem related to the airways, we go for some of the medication. The medications examples are, the first thing is that we have to stabilize this. Mast cell stabilizers, we go for it. The medication examples of mast cell stabilizer is sodium bromoglycate. Then for histamines, we go for antihistamines less. Cetirizines, levocetirizines, loratadine, desloratadines, chlorpheniramine, we might have come across. For LT leukotrienes, we go for LTR, leukotriene receptor antagonists. Most commonly, we use this medication, montelukast, zofilukast. Next, for interleukin 4 and 5 release, we go for anakinra. Then to avoid these cytokines, because remember, if cytokines are released, they lead to severe asthma. In severe asthma, we have to go for monoclonal antibodies. That is, omalizumab should be given. And for eosinophils, we go for the medication called as aminophilins, theophilins combinations. We go for it. But these are some of the medications which are being much more commonly used in the treatment of asthma. So please check the question number 20 first. A woman suffer from acute asthma attack. What is the best choice for her attack? Will be able to see salbutamol. In the tomorrow class, we are going to study about the question number 19, which is related to COPD, chronic obstructive pulmonary disease is being there. Then we'll understand the question number 3. Any doubts? You guys can go ahead.